Hey there, welcome to another episode. I am so excited you're here. If this is your first time, my name is Chong and I'm the founder of Pristine Fertility and a certified fertility dietitian. Now, my goal is to share with you evidence-based nutrition insights to help you to get pregnant and stay pregnant. So be sure to subscribe to our channel so you never miss an episode. Now, if you're trying to conceive naturally, knowing your cycle, tracking your ovulations, and learning how to spot what's normal period or what's not is the key to pregnancy success. So in this episode, I'm going to break down what a normal cycle looks like and what might be considered abnormal so you can understand your period better and also time your conception more accurately. So let's get started. All right, let's start with a basic. What is considered as a normal period? So a normal menstrual cycle typically ranges from 21 to 35 days for an adult woman and should remain fairly consistent from month to month. And the average cycle length is typically around 28 days. But you may also notice that certain months can shift slightly, usually give or take about 2 days difference, and are perfectly normal. Now, your menstrual cycle includes 3 key phases. So one is follicular. Secondly is what we call ovulatory. And lastly, number 3 is what we call luteal phase. And so controlled by hypothalamus pituitary ovarian axis, also known as HPO, right? So let's go through what the first phase of your cycle means. So it's called the follicular phase. So follicular phase begins usually on day 1 of your period. So it's the first day you start bleeding and continues until ovulation. So during this phase, your body prepares to release an egg. So there's a hormone called FSH, follicle stimulating hormones, will rise and signal your ovaries to begin developing the follicles, right? So these are small fluid set and each one contain an immature egg. And typically, if you're trying to conceive naturally, there's only one dominant follicle will continue to grow and mature. And as it develops, it will produce more estrogen hormone, which also helps your body to thicken the uterine lining to prepare for possible pregnancy. Now, what's important for you to know is that the length of the follicular phase can vary about 14 to 21 days. So again, depending on how quickly your body prepare the eggs for maturation. And this is why every woman is different, because the total length of a cycle, some certain month might be shorter or longer, because this is the first half of the cycle that tends to change the most, right? So the follicular phase is also the longer phase of your menstrual cycle. Now, if your cycle are irregular or if you're unsure whether you're ovulating or not, it's a sign to look deeper at your hormone health. Now, I have created a free fertility lab test checklist for you to help you to understand better what's happening inside your body. I have listed out all the common key fertility blood tests for you to understand and discuss with your doctors and understand a little bit more how it relates to your menstrual cycle and fertility. And you can grab these free checklists by visiting the link below our description box. All right, moving on next, let's chat about the ovulation phase, right? This is the biggest event of your menstrual cycle, especially if you're trying to conceive. So during ovulation, we talk about the dominant follicles earlier on. So the dominant follicle that develop in the follicular phase will release a matured egg, right? And this is usually triggered by a sudden spike of luteinizing hormone, also known as LH. And this is also referred as the LH surge, which is commonly used by many ovulation tracking urine test kits that detect this surge, right? So once the egg is released, it will begin its journey down the fallopian tube where it can be fertilized by the sperm. And this process will officially mark at the end of the follicular phase, and you will start the luteal phase. Now, here's the most important part of the ovulation phase, which is identifying the fertile window period also known as when is the best time to conceive. The reason why is because now sperm can live up in your body for 5 days inside your reproductive tract, while the eggs can only survive for about 12 to 24 hours after ovulation, right? So this means that your fertile window is roughly about 5 to 6 days long, ending the day after ovulation. So you don't want to wait here, you detect ovulation, then only you do the baby dance, the action. You actually want to maximize the chances by starting, right, timing the baby dance actions 5 days before your predictable ovulation day, right? So some of the signs that you may notice as your ovulation comes closer is the changes in your cervical mucus. Usually you will notice a clear, stretchy, slippery, like egg white texture, or you might noticing a slight rise in your body temperature, basal body temperature, which is the first temperature you measure before you even get out the bed, that usually also signaling the sign of ovulation as well. Or for some women may also feel like the mild cramps or ovulation pain on one side of the lower abdomen. Or for some women as well, there might be also a boost in libido. So if you're trying to conceive, learning how to track ovulation, once again, it's one of the most important steps and powerful tools aside from changing your diet, your lifestyle, taking the right supplements. Now, if you're interested to learning more about this topic, I have previously interviewed the wonderful and one of the top fertility specialists in Australia, Dr. Simon Northman. We chat about this topic a little bit more deeper. If you're interested, don't forget to also watch our previous episode and you will find the link at the end of this video. All right, let's chat about the last phase of your menstrual cycle, also known as luteal phase. So this is exactly the phase after ovulation. So your body will enter the luteal phase, which is the final part of your menstrual cycle. And here's what's happening. So the follicles that release the egg will transform into a structure known as corpus luteum. Right. So the corpus luteum job is to produce progesterone, which is a hormone that helps your body to thicken and stabilize the uterine lining, making it a more welcoming environment for a fertilized egg for implantation. And if fertilization and implantation happen, this is when progesterone will continue to stay high and continue to rise to support early pregnancy. But if not, the corpus luteum will start to break down after about 12 to 14 days, and progesterone level will start to drop and your period will begin again, starting another cycle. What's important for you to take note is that the luteal phase is generally pretty consistent in length, usually lasts about 12 to 14 days in most women, right? And like I spoke about before, follicular phase tend to be the phase that may vary. For some women can be shorter, for some women can be longer. But like I say, luteal phase usually are pretty consistent, right? And that's why the luteal phase is also often used to help predict your next cycle as well. So during this phase, you may also experience some tender breasts, mood changes, you might feel a little bit irritable or bloating or fatigue. And these are some of the common signs that your body responds to the rise and the fall of progesterone. Now, if your luteal phase is too short, typically less than 10 days, it might also signal that it's not enough for the embryo, right, to implant successfully. And this is also known as luteal phase defects. And it's something that to look into it if you're tracking your cycle and noticing, for example, early spotting, right, in between the cycle, or you notice that you experience a very short cycle after ovulation as well. So absolutely, understanding your period cycle, the pattern of when you have your periods again are really crucial signs to helping you to maximize your chances of getting pregnant.
You can't control how many eggs you were born with or how age affects the quantity. But here's the good news. You can definitely influence your egg health. So over the next 90 days, the eggs preparing for ovulation are directly impacted by what you eat, how you live, how you manage stress, your hormone balance, and even the inflammation and oxidative stress in your body. That means your daily choices matter more than you have been told. Hi, I'm Catherine, the Fertility Dietitian, and I want you to know that you don't need to pause the clock. You just need to give your body the right tool and support to protect the eggs you still have. Want to learn more? Make sure you grab my free fertility e-guide now and discover the 10 powerful strategies to optimize your egg health naturally starting today. Click the link in the description box and grab your copy now.
Welcome back. Now let's look at the final things that we're going to chat about today is how do you know if your cycle are not normal? What are some of the warning signs that you need to watch out for? So here are some important points that I want you to pay attention to your period and cycle when you try to conceive. So number one, your cycle length is constantly changing, right? Like I say, it's okay for your cycle slightly vary month to month. Typically, we're talking about, say, 28 days could be last month, and then the next cycle is about 30 days. It is still acceptable. However, if you notice that your period cycle, the days tends to be less than every 21 days, so a lot shorter, or even more than about average 35 days, then I would say that that's certainly, something that you may want to discuss with your doctors and run some hormonal tests and to find out if anything underlying, right, that can also potentially impact your fertility. And number two, your period basically just skip or lost entirely. So missing a period here and there can also happen, sometime when we feel stressed or maybe we are not feeling well that month. But if you're noticing that you don't really get a lot of period, right? Or you may not even have bleeding for months, for 6 months, it's often also a sign that your body may not ovulating. Right. And it's important to remember that if you're trying to get pregnant naturally, we need the cycle to work properly. We need you to ovulate before pregnancy can happen. So absolutely, this is one of the warning signs that you may want to take it seriously. And number three, noticing very heavy or very light period, right? So if you are soaking through like pad or tampon, every hours for several hours, right? Or you bleeding for more than 7 days, right? Like we're talking about heavy menstrual bleeding. It may also indicate that, issues such as fibroids or hormonal imbalances. And on the flip side, if your period is like really light, right, it could also mean that your uterine lining isn't thick enough to support implantation. So absolutely, you also want to pay attention. And number four, you may notice that spotting in between your cycle. So that's another key sign, and it could generally related to hormonal imbalances or could be polyps or could be other uterine issue that you want to also speak to your doctor for more investigation. And number five, severe pain during period, right? Although for some women, it's common that you might experience cramping or pain during your cycle, but if your period pain is so intense that you can't even function, you have to lie down on bed or you need to take strong painkiller, right? That's not normal. And it could be a sign that you may also experience endometriosis, adenomyosis, or even chronic inflammation as well. So again, pay attention to what your body is telling you. And lastly, short luteal phase or early spotting like we spoke about earlier on in today's episode. So if you ovulate but get your period less than 10 days later, or you're noticing spotting for several days before your actual period start, once again, it may also signal what we call luteal phase defects, and this can also impacting on implantations as well as the early pregnancy. So to wrap up and sum up today's episode, if you experience any of these abnormal signs, do not panic, but also don't ignore them either. So make sure you take the actions and consult your doctors for appropriate health check-up as well as hormonal and lab test assessment to really find out what's going on with your body to help you to enhance the likelihood of pregnancy success. And as usual, I hope that you found this video helpful. Don't forget before you go. Also to grab our free fertility lab checklist so you know exactly which blood test to ask for with your doctors and which one is helpful to guide your fertility, so you have a much informed discussion with your doctor. The link is in the description box below. Now, if you enjoyed today's episode, please give us a like, subscribe to our channel, and drop any questions you have in the comments box below. And thank you so much for watching. I'll see you again in the next episode. Bye for now.